support the press release. Thank you. Is there any other members wishing to speak to the referral amendment? The Honourable Minister of Status of Women and Service Alberta.
Thank you, Madam Speaker. It's my pleasure to speak to the referral amendment. There seems to be a lot of misinformation being communicated throughout this House as well as outside of this House, and so I'd like to take another opportunity in addition to the comments that I made upon introduction of second reading to provide further clarification. First of all, the bill makes it very clear upon the face of reading it that the legislation only applies to household pets. Livestock is not included. It seems that I need to reiterate this a number of times because despite the clarity on the legislation on the very face of it, which specifically says household pets, there may be confusion to individuals as to whether or not a horse constitutes a household pet. But I assure you, Madam Speaker, that is not the case. Animals that are raised for the use of food in our food chain is also not contemplated again as household pets, would not constitute part of livestock or our food chain. Madam Speaker, this legislation, this piece of the legislation in respect of veterinarians, which seems to be the turning point for the referral amendment from the comments that I've heard, is quite simple, Madam Speaker. It does two things. One, it requires veterinarians to disclose all fees and obtain a client's consent prior to treating their household pets. And it seems to me that the association agrees with this. They have said that this is something that is a best practice of their profession, that this is something that they want veterinarians to do. And so it seems to me that it would be very simple for vets who are acting in the highest of integrity and in good practices, as I agree they are with the members opposite, to do this. So no problem. Okay, so then the next piece is with respect to giving permission to veterinarians to advertise or post their fees. Now, this is a simple matter of transparency. I think that it's something, transparency, the value of transparency is something that we can all get behind. Madam Speaker, the assertions that somehow the ability to post or advertise fees would degrade a profession, I think is something that is a comment that is unsettling to a number of professionals, lawyers included, as lawyers, in fact, are permitted to advertise and post their fees, yet there's no suggestion, and I think it would be inappropriate to suggest that that would somehow suggest a degradation. Furthermore, I completely agree. The vets that I've dealt with, many, if not most, the vast majority are very honest, upstanding. They take the highest standard of ethics to heart. They put their patients first, and they want good outcomes. And so I certainly don't buy the suggestion that by allowing them to advertise that they would somehow put their ethics aside and that they would put the quality of care aside simply because they're now allowed to post their fees. And certainly, if somebody were to suggest to me as a lawyer that in my practice before that I would put aside my ethics simply because I am allowed to post my fees, I would be offended, Madam Speaker. So certainly, this is a good thing for consumers. Madam Speaker, I've heard from Albertans, I've heard from individuals who are afraid to take their pet into a vet because they've zero clue of what the costs that they could incur if they walk in the door. And this kind of concern it can lead to negligence on the part of a pet owner in not taking their loved pet in for good care because they're so paralyzed by the fees. And so this is just good information, arming individuals with more information so that they can make the best, most informed decision. I wouldn't suggest that anyone would put aside the quality of care of their loved one and just engage in a race to the bottom. Madam Speaker, I don't think that does justice to the conscience of most Albertans and most pet owners who want the best for their loved ones. So, Madam Speaker, I am speaking against this referral. The comments made by the members on the other side of the House, they just don't hold water in this regard. Another consideration is that, we talk about the medical profession in the United States, which is entirely, privatized. Doctors operating on humans, they advertise their fees. And again, I think that they would likely take umbrage with the assertion that their advertising of fees causes their services to be degraded in some way. So this really just gives the owners of their loved pets more tools to be able to make a well-educated decision so that they can find quality of care, because all vets are going to give that quality of care. I believe the member opposite when he says that. But also be able to find that quality of care within their budget and not have surprises. So there's many good protections in this legislation. Madam Speaker, we've heard from a number of our stakeholders, and they've told us, Madam Speaker, that they are in support of this. Just briefly, I will quote Janet Ryapel, the President and CEO of Edmonton Chamber of Commerce. She said that consumer confidence and fair competition are essential for a vibrant and healthy economy. Business people understand this, and the vast majority treat their customers fairly. The Chamber hosted sessions, they were lovely, to ensure our members' voices were heard through these consultations. And she says, this legislation shows the government was listening, and we're confident it will foster even greater trust between consumers and the business community. And they know that's good for business. The people who are at the front lines of this know and appreciate that. And there were some comments too about automotive repair. Our legislation is supported by a small business owner, for example. The owner of Sandy Lane Auto is supported by the Alberta Motor Association, who is very trusted in Alberta. They've said, we believe all Albertans should have confidence in the service they're receiving. They've got a long history of standards that make them the experts, really, on the voice of this. And so I would encourage the members opposite to listen to the experts. Bill Burnett, the chair of the AMVIC Board of Directors, has said, I am very excited about the announcement of Bill 31, a Better Deal for Consumers and Businesses Act. It's a very important step to support AMVIC's mandate of consumer protection in Alberta. Thank you to the Government of Alberta for their leadership and commitment to consumer protection in Alberta. The opposition speaks of listening to the experts. And the evidence on this, the support that we have for this legislation from the experts shows just that. And so I would suggest that they should take their own advice on this matter, Madam Speaker, and that they should support this bill. There's certainly protections with respect to ticket sales, Madam Speaker, the issue of bots. Yes, this is a very complicated issue, software buying up tickets. It's said time and time again in every bit of ink spilled on this issue that it's a complicated issue, that there's no simple solution. But we are in the forefront of this issue here in Alberta. This has not been done in Canada previously, and so certainly we will be watching the situation, but these are first steps, and we have support from the music industry, on this from artists. We have support from their promoters. We have support from primary sellers. This is truly a team effort. We are taking different enforcement steps than have been tried in the United States. We're taking different enforcement steps than are being proposed in Ontario. And we feel that this is a made in Alberta solution. We have a different market here in Alberta. It's smaller than what you see in Ontario, and so it requires a unique approach, Madam Speaker. I just want to touch again on the veterinary piece of this legislation. We consulted. We had 2 in-person meetings with the association. We had an additional phone call with the association. I'm told that this is, in fact, more consultation that was done than when there was the amalgamation of the technologists and the vets. There was good and substantial consultation. We're very clear on the position, but we've also spoken to individual vets, Madam Speaker, and we've heard support from individual vets. We also have spoken to pet owners, and pet owners are very pleased with these changes. Madam Speaker, there's also been some comments from the members opposite suggesting that putting vets into this legislation somehow by association is insulting. And I don't think that that's a fair comment to make with respect to those who regulate auto sales and repairs. I don't think it's a fair thing to say to those who sell new or used vehicles. I think that those comments really bring down the level of discourse when we're talking about Alberta's businesses and Alberta's small businesses, the contributors to our very economy. They drive so much of our economy. They're quite pleased that we are taking action on those gray areas where there are those who bring down the reputation of the industry, of various industries. And some of these pieces in this legislation, Madam Speaker, touch a wide range of industries, touch almost every industry. There's provisions in here with respect to contract terms. Now, there are so many industries that engage in contracts as part of their business operations. And so to suggest that they're bad company for vets, that 99% of Alberta's companies would be, of their businesses would be bad company to keep for vets is in my view and my colleagues here, not something that we would ever say. We support Alberta's businesses. We support Alberta's small businesses. And Madam Speaker, they're pleased with the action that's being taken here because overall, this legislation will increase consumer confidence, which is good for the bottom line. It brings up the overall level of discourse. And Madam Speaker, we've heard from the opposition about wanting to remove, quote, red tape. There is red tape on the veterinary profession. Not being able to advertise or post your fees is red tape. Those businesses are not able to operate their business in the fashion that they see fit. Now, I understand that there's been, some discussion through the association from a number of their members on this issue, but I have heard from vets that they would like the opportunity to be able to be more open and transparent with their consumers, that this would be good for consumers by being able to post their fees, which they're prohibited from doing at the moment. And so we're removing that prohibition and giving more flexibility. Obviously, they're not required. It's very clear on the face of the legislation. They won't be required to advertise their fees. They won't be required to post them. And so this is additional freedoms Much of this legislation, frankly, deals with improving freedom of speech, improving freedom of speech for Albertans. There's pieces in here that have to do with the ability to post an online review, Madam Speaker, without being able to be threatened by a business with intimidation because they simply do not like an honest but good faith review. And so these are principles that we hold dear, principles of free speech, principles of access to information, principles of being able to make good, informed choices.
Thank you, Honourable Minister. Are there any members wishing to speak to 29-2A? Seeing none. 29-2A, Honourable Member?
No, not 29-2A.
Okay. The Honourable Minister of Children's Services.
Thank you, Madam Speaker. I just wanted to ask if it would be acceptable to the other members of the legislature if we would temporarily revert to introductions to introduce some members in the gallery. If we can ask, please.
Having heard the motion by the Honourable Minister of Children's Services to revert to introductions, all those opposed, please say. Seeing none, please continue.
Thank you.
The Honourable Member for Stony Plain.
Thank you, Madam Speaker. It's my honor today to introduce some of the members of one of our largest and strongest unions here in Alberta, and a union I was very proud to be part of as an LPN. And Vice President Mike Dempsey and the Political Action Committee, if you could please rise and receive the warm welcome of the Assembly.
Thank you, Honourable Member. Are there any members wishing to speak to the bill? The referral amendment, my apologies. The Honourable Member for Vermilion-Lloydminster.
Well, thank you, Madam Speaker, and of course you had to expect that after the Minister's rambling diatribe that there was going to be a response. Madam Speaker, you know, it's interesting because this is a debate on referral, and the purpose of the referral in this case is to allow for the consultation that did not happen. It would allow for the minister to actually meet with the Alberta Veterinary Medical Association, which she refused to do. It would allow for multiple, dialogues on a number of different things that are located within this bill, but I'm going to confine myself to some of the comments made by the minister and by others with regards to the bill. Now, the minister stood up, and she stood up last night, and she said it again just now, saying that this bill would only deal with household pets. Well, if it only deals with household pets, why doesn't it say that in the bill? Nowhere in the bill is the phrase household pet. The phrase in the bill is in respect of a domestic cat or dog or other specified type of domestic animal. Cows are domestic animals. Pigs are domestic animals. Horses, sheep, goats, elk are domestic animals. And so the minister says household pets. If that's what she means, household pets should appear in the bill, not a wide open domestic animal definition. And so if that's what you're talking about, that's what needs to be in the bill, and that is part of the reason why it's important that referral be done so that we can take another look at this bill to get the proper language. Right now, the minister's...
My apologies, Honourable Member. There's a lot of talking back and forth. If we could please just allow the member to speak to his referral amendment. Thank you.
Thank you, Madam Speaker. So if the intention is to talk about household pets, then let's have that language in the bill. Right now, the bill allows Cabinet to designate which domestic animals are included, and you can understand that the members of the Veterinary Medical Association, who I'm sorry, I will respectfully disagree with the Minister from Service Alberta, who were not properly consulted, and the consultation was a shadow of the consultation that was consulted with the Minister of Labour on the bringing together of the associations. And so to suggest that there's confidence within the veterinary profession for this, for the Cabinet taking over the definition of what constitutes a domestic animal under this bill, that confidence has been shattered by the actions of this minister. Now, the next little thing that I found interesting was rely on your experts. Remember we heard that phrase, rely on your experts. Who exactly are the experts when we're talking about veterinary medicine?
Oh, the NDP.
Is it Cabinet? Is it the Minister for Service Alberta? I would suggest, Madam Speaker, that the experts in this field are in fact veterinarians. And veterinarians have come out in large numbers and have written to this minister, have written to me, have written to most of the members, I would suggest, here in the chamber, and have indicated their displeasure with this bill. And they've been very clear on that. Because this bill takes a direct attack at the self-regulating nature of our profession, and it takes a direct attack on our ability to govern ourselves and to decide not only what is best for our profession, but what is best for the welfare and health of animals in Alberta. And that is a responsibility that we have had since Alberta became a province, and it is a responsibility we take very, very seriously. Now, the minister mentioned about concern about transparency on costs, and that there were some people who were scared to go through the door of a veterinary clinic for fear of what it might cost. What a ridiculous statement. What a ridiculous statement. Unlike some businesses, lawyers I would point out, we don't start charging people the minute they walk through the door. We provide lots of free advice, whether it be on the phone or over the counter, and if somebody wants to know what a veterinary procedure will cost, we provide that information willingly over the phone. Every veterinary hospital that I've ever been associated with has dealt with what we call price shoppers. And there are price shoppers that are there every day, people that ask for the price of a service. But whenever we got a call from a price shopper, what we did was engage in a conversation with that person to let them know what was included in the price, what sort of procedures we took, what protocols were included, so that they understood exactly what it was that they were purchasing. You know, Madam Speaker, I started veterinary practice in 1983. And in 1983, performing general routine surgery, things like spays and neuters on dogs and cats, was very different from what it was when I retired in 2011. And in some ways, I am so very glad that our profession moved forward over that period of time, and it has moved forward since. I would never do a spay or a neuter today the way I did it in 1983. Never. Because it would be not the best care for the patient. Now, have those changes resulted in additional costs? Yes, they have. Those changes to the way we do things in the operative theater, in the examination room, those things cost money. And they have increased the cost of veterinary care. There's no question there has been an increase in the cost of veterinary care. But there has been a commensurate increase in the quality of veterinary care. And when the price gets driven down, so does the quality. And price competition, whether it's in veterinary medicine or in other fields, results in a decrease in quality. That has been the experience in every other jurisdiction that has allowed the advertising of veterinary fees. That is what has happened in British Columbia. That is happening in Ontario. And it has happened in multiple jurisdictions in the United States where that has been done. Now, you can call it a better practice because of transparency. You can call it a number of different things, but in reality, it results in the degradation of practice. It results in the degradation of procedures. And it is not in the best interest of certainly veterinary medicine. It is not in the best interest of the client, but most important, it's not in the best interest of the patient. The patient cannot speak. Who speaks for the patient? Who is the patient's advocate? In most cases, that is the owner, but in many cases, the owner does not have the knowledge or the information to know what is best for the patient. That knowledge, that information comes from the veterinarian through his or her training and experience. Clients come to us asking for our recommendation based on what is called Esculapian authority. Esculapian authority is a term used in the medical profession and also the veterinary medical profession, and it indicates the authority we hold because of our knowledge, because of our experience. And just like a lawyer has authority and knowledge in their field that we rely on, or an accountant or another professional, veterinarians have knowledge that we apply in our situation. And that knowledge, Madam Speaker, is gained over time. It is gained at great, tremendous personal cost, and that knowledge has value. And so over the years that I was in practice, yes, things became more expensive. But those fees were to cover better quality veterinary medicine. Those fees were to do better sedation, better anesthesia, better intra and post-operative pain control, better materials that were less reactive to the patient. They allowed for intravenous anesthesia, intravenous monitoring, and intravenous support of the patient. When I first graduated in 1983, we didn't put dogs on IVs for spays. Unbelievable today. I would never spay a dog today without an IV line. But in 1983, that was okay. And so that meant that the procedure was cheaper in 1983. And if you want to make a procedure significantly cheaper, you have to cut corners. There is no other way to do it. Now, the concern over costs is not one that is foreign to veterinarians. We deal with the need to balance the owner's ability to pay with the cost of providing the service every day, Madam Speaker. And in our situation, we've come up with a lot of different ways to help owners with that. We encourage owners to take pet health insurance, which is widely available to shield them against the shock of a large veterinary bill. We have started 4 different charities in Alberta that provide financial assistance to clients who require assistance for veterinary care. 4 different charities exist in Alberta. They all have significant veterinary involvement. We want to be able to help our clients treat their animals. And we provide tens of thousands of dollars every year in pro bono work, stuff that we do for free or at severe discounts just because we care about our patients, we care about our clients, and we want to do what's best for them. And so while this minister says this isn't an attack on veterinarians, maybe you should ask the veterinarians how they feel about it. And I will tell you from the hundreds of letters that I have received, we feel under attack. We feel that we've been targeted. We're the only self-regulating profession that's in this bill. Our doctors here? No. Our lawyers here? No. Our dentists or pharmacists or chiropractors or physiotherapists or geophysicists in this bill? No, none of them. But veterinarians are. Veterinarians are. And Madam Chair, Madam Speaker, rather, that is a problem. And so consultation is something that we value and we would like to see this minister undertake with us. So that's why I'm in favor of referral. Referral will allow for a more robust discussion that lasts longer than a week. When I told my colleagues that this bill received first reading last Wednesday and then it was to be passed by Thursday, their reaction uniformly was shock. How can the government do this? How can the government, in the space of a week, turn around the way a profession has been operating in this province for 111 years? And when I told my colleagues it can be done and that's what is underway, they were shocked. And so that is why I'm saying that if this bill is referred to committee, we at the very least have the opportunity to hear properly from veterinarians, and yes, hear from clients who feel that they would be better served by having fees advertised. And it would be an opportunity to have that dialogue and in fact discuss why fee advertising, where it has been tried in other jurisdictions, has always been an unmitigated disaster. I'll say that again, an unmitigated disaster. Talk to veterinarians who practiced in British Columbia through the 80s and the 90s and ask them what fee advertising did to their profession. Alberta veterinarians don't want that. My colleagues have already stated what the level of complaints that we have to our association. They are astronomically low. When one considers the number of veterinary transactions, the number of interactions that we have with clients and patients on an annual basis, 36. The percentage involved is so minuscule. Now, could we do better? Yes. And we strive to do better all the time. Our association has staff, has volunteer council members, have many, many members, myself included, who volunteer for discipline tribunals and practice review and practice inspection to try to always improve, to continuously improve veterinary practice in Alberta. That's what we try to do. So that's why we find this bill brought in on such short notice, brought in for no explainable reason, even though we asked the Minister of Labour, we asked the Minister of Services of Alberta back in August, what is the driving force behind this bill? Why does it feel that this is necessary? We didn't get an answer from either one. And then the one answer we did get from the Minister of Services of Alberta is that there would be extensive discussion, consultation, and engagement. Well, that hasn't happened. And also, we would much prefer, frankly, to deal with the Minister of Labour, who is responsible for the Veterinary Profession Act, not the Minister of Service Alberta. Why? Well, that's a good question, one that has not been answered by either minister. So, Madam Speaker, that is the reason I'm pushing for referral. That is the reason I speak in favor of referral, specifically with regard to the provisions within the Veterinary Profession Act. We are a proud profession. We work hard. And we have done nothing to earn the ire from this minister or to be targeted by this government in this way. But if they do want to proceed and steamroll the veterinary profession, I guess that's their prerogative. But I didn't think, and I certainly had hoped, it would not, Madam Speaker, come to that.
Thank you, Honourable Member. Are there any members wishing to speak to 29-2A? The Honourable Member for Bonnyville-Cold Lake.
Thank you, Madam Speaker. I think we all can learn from that member, seeing his passion for his profession. I think that anybody that has taken the time and put a lot of years in dedicating it to an industry, in my case it'd be accounting, for him it's the veterinarian practice.
Well, one of those is exciting.
I can tell you that when it comes to a government moving on a professional body that regulates it, that is an attack on an entire profession. That is an attack on exactly what it is that we are trying to prevent, which is creating red tape so that they can no longer do their job. To hear the minister say that we are reducing red tape by bringing this legislation is preposterous. And I would like to hear a little bit more from that member from Lloydminster, how he feels that the minister can really justify this lack of consultation when it comes to such an important topic, and to say that 1,300 online surveys really will improve the ability for him to help the pets that are within his care.
Honourable Member.
Well, Madam Speaker, I'm happy to say that. I mean, my responsiveness within my practice was always to talk direct to my clients, and I encouraged that. And you know, it's interesting, one of the provisions in this bill was with regards to negative reviews online, and I actually support those provisions. I think those are a good idea, but just of interest sake, I went to the Facebook page of my practice, or now my former practice, to see how they're doing. Of the 27 reviews they've received, 26 reviews are 5-star and 1 is 3-star, averaging 4.9. I was proud of my colleagues. They are doing a good job, and they continue to do a good job. And you know, they don't need the provisions within here, but don't take it from me. For years, the Alberta Veterinary Medical Association has had a public member on the board, and that is to protect the public interest. And I received this quote from a public member. As a 7-year public member of the ABVMA, I can state without bias that the current act is working for Alberta's public. Veterinarians receive specific training about client relations, fees, records, and other critical areas of professional communication and practice when they get their provisional license. I note that public member input for amendments was not sought in any form by the Minister of Service Alberta. Public members are the eyes and ears for Alberta's self-regulated professions. Minister, why didn't you pick up the phone and ask the public members that you've got sitting on the ABVMA board whether they have input into this? Why have we been singled out for this treatment? Why have we been attacked? You can't tell me that accountants don't have big bills. You certainly can't tell me lawyers don't have big bills. That seems to be the only criteria. And the reason we have big bills is because of the quality of practice and the demands of the public. The public want orthopedic surgery. And you know what? If you need your dog's hip replaced, you don't have to wait 10 months. You can get it done within the week. If you need nuclear scintigraphy on your dog, you can get it done within days. If you need to go see a specialist, you can have that done within days as well. That does cost money. I recognize that. But to suggest that there is price inflation, then that somehow that is, unfair to the general public. The general public are the people that are demanding these enhanced services. I myself have been the consumer of these enhanced services in the past year, and yes, they are expensive. And you know what? They're worth every penny. They're worth every penny because my colleagues are professional, my colleagues provide value, my colleagues are in touch with clients, and they know what they're doing. They deserve it, they have earned that right, and they have the knowledge, the expertise, and the dedication and the experience to be able to provide that service, and I think they provide it not just for me, but for all Albertans. And I would like them to be able to continue doing that in the future. Thank you, Madam Speaker.
Thank you, honourable member. Are there any other members wishing to speak to 29-2A? Seeing none, we're back on the referral. Are there any other members wishing to speak to the referral? The honourable member for Littlebow.